trying to mandate somebody taking the AIDS vaccine. It doesn't work.
It was embarrassing as a Georgian that the highest elected official in my state, not once, not twice, but three times, continues to spread misinformation about a vaccine in the midst of the worst public health crisis in the country.
There are people that have doubt that's out there because they haven't been all three fully authorized yet, and then mixed messages out of the Biden administration. And plus, just like the AIDS vaccine, mandating it didn't work. It only worked when they started educating people why it was a good idea.
As a Georgian, it's certainly frustrating that the governor justifies being a do-nothing governor by trying to invoke a vaccine that does not exist. There was no AIDS vaccine mandate because there is no AIDS vaccine. To try and use that as justification to do nothing but to prevent other leaders in the private sector, in the public sector, from using all the power that their voters vested in them to protect members of our community from this unprecedented pandemic makes no sense in my mind whatsoever. Kemp's actions, unfortunately, demonstrate that what he cares about more than anything are his politics, more so than the public health and safety of Georgians, which is unfortunate. I think it would be reasonable if it was a gaffe or a slip up if he made it once, right? But the fact that he said the same thing three times.
They're trying to mandate somebody taking the AIDS vaccine. It doesn't work.
That's basically how the AIDS vaccine worked. You know, people wouldn't take it early on because it was mandated. They started educating people, and now it's doing a lot of good out there.
Plus, just like the AIDS vaccine, mandating it didn't work.
I mean, come on, right? I mean, I know a few of my colleagues think that it's more than just a slip of the tongue, but you know, at the very least, I hope it's not too much to ask that Governor Kemp would take ownership of his mistake and set the record straight for the sake of public health crises we're trying to combat. As a gay man in the South, in the midst of an HIV/AIDS epidemic, who's also working to end the epidemic, it's incredibly infuriating because it undermines our efforts to ensure that folks get into care, that they have actual access to medication that would allow them to be virally suppressed, and to take meaningful steps to end the epidemic.
They're trying to mandate somebody taking the AIDS vaccine. It doesn't work.